Hi everyone, welcome back to my channel, Nurse Katherine here. In today's video, I will be teaching you the 8 different classifications of fractures in this 5-week series on musculoskeletal injuries and traumas. Not only is this pertinent information for nurses to know, this is also information for EMS workers that can come in handy when you are on the job. I would see a wide variety of these fractures when working in the emergency room. It is important for EMS workers to know these classifications as well, because you must know how to call report when calling in to that head nurse of the ER. Some of these fractures may land your patient in the trauma bay, so it is so important to know these classifications of fractures. In this video, I will also be providing some pictures and scenarios of how these fractures can happen. Before we get into it, do not forget to subscribe to my channel and give this video a big thumbs up. Other than that, let's get started. To begin, we are going to start with our easiest classification of a fracture, and that is a closed fracture. A closed fracture is where skin is intact over or near the fracture site. This can happen in a wide variety of situations, like falling and catching yourself with your hands. Next, let's move on to a complete fracture. A complete fracture is a bony cortex is completely interrupted. This also can happen in a wide variety of situations, like falling and catching yourself with your hands again. Our third classification will be an incomplete fracture. So we just had complete, now we have incomplete. Incomplete is when the bony cortex is not completely interrupted. This also could be known as a hairline crack. This also can happen in a variety of situations. One would be jumping off a high surface and coming down hard on your ankles and creating that hairline fracture. Next is a comminuted fracture. When I think of a comminuted fracture, I think of community, that's C-O-M. Now here is why. This happens when bone is splintered into fragments. Think part of the bone is just broken into a lot of different pieces. Think of community. There's a lot of people in a community. Your bone is splitting into a lot of different pieces. This could happen in war from explosives or even during a car accident. Our 6th classification of a fracture would be a green stick fracture. A green stick fracture happens when your bone bends or is buckled. Think of a green branch that you are breaking off of a healthy tree, and think of how it breaks. That is how a green stick fracture looks. The 7th classification of a fracture is pretty easy to remember, and that is an impacted fracture. The bone is wedged into distal and proximal fracture sites. Think of a car-to-car impact. So you have these two coming and impacting to one another, and they're just smushed to one another. These cars are now jammed together. That is like an impacted fracture. And lastly is a displaced fracture. This happens when the bone fragments are not aligned. They are just totally off from one another. So to realign those bone fragments, you need to do a reduction, it's called. This does not happen in all scenarios, but it may happen for your patient. So we just went over the different classifications of fractures. In this picture, you can see different types of fractures as well. But other than that, that is it for today's video on musculoskeletal injuries and traumas. Make sure you do hit that notification bell, because you need to be alerted when new videos are coming out, especially next week's video. We will be going over assessment findings in musculoskeletal injuries and traumas. I also do post vlog-styled videos every Saturday, so you will be alerted for those videos as well. Other than that, that is it for today's video. Thank you for watching, and make sure you do like this video, subscribe to my channel, and hit that notification bell. Other than that, that is it. Have a great week, and I'll see you in Saturday's video.